Welcome, everybody, to today's episode of Sam Talks Telehealth. I'm interviewing Dr. Ben Schwartz. He's an orthopedic surgeon, digital health mentor, and advisor. And it's great to have an opportunity to see his insights in the digital health space. So, without further ado, let's get to the show. Okay, Dr. Ben Schwartz, thanks so much for joining Sam Talks Telehealth. How are you today?
I'm well. How are you?
I'm doing great. It's very nice. We know each other from the internets of, Twitter and LinkedIn. And so it's nice to have you on the show.
Yeah, it's good to be here. Thanks for having me.
So let's kick it off. I always like, we kind of go rapid fire questions. And, why don't we kick it off, though, with you talking a little bit about who you are, the kind of work you do, so the audience knows.
Sure. Yeah. So I'm an orthopedic surgeon. I practice outside of Boston in the suburbs. I specialize in hip and knee replacements. That's my day job, but I have an interest in healthcare technology. And over the last several years have kind of fed that interest with mentorships, advisories, getting involved in health tech startups, and then connecting with people like you and having these conversations.
Awesome. So that actually leads really well into the first question, because you have done mentoring and advising. So what do you look for, and what do you think is important for digital health innovators as they're creating their products?
Yeah, I've always been a proponent or pushed for having experience. So if you're bringing a solution to healthcare, maybe you're outside of healthcare and you haven't been on the front lines, figure out a way to get some experience, shadow a physician, work in a healthcare setting, and really see how it's delivered on the front lines. Because I think a lot of what we do, or at least some of what we do, may not be intuitive to somebody that's outside of healthcare. I think it's great to have fresh perspectives and fresh approaches and fresh minds. A lot of people excited about healthcare, but you may not understand some of the unique challenges that you get into that clinical setting. It's like, oh, now I understand why this idea seemed great in theory. Maybe in practice doesn't work quite as well, or at least it helps you bring solutions that are more likely to be adopted, to market, or have more success if you understand that care delivery. So that would be my recommendation. Figure out a way to get some healthcare experience, or if you can't, at least put people on your team that have that real world experience and involve them early and often, because I think that is what's going to be more successful and more sustainable in the long term.
Yeah, and I think definitely it's something, we talk a lot about, where you've got these great tech innovators, but then without that clinical expertise, clinical experience. Now, what would happen though, really, like if a tech person comes to you and say, oh, hey, can I shadow you in the OR? I mean, we know how complicated it is even to get in the door of anywhere. How would that work in a practical standpoint?
Yeah, I mean, in the past, COVID has changed things a little bit, because we don't want people there that don't necessarily need to be exposed. In the past, but it was, you could shadow. You just had to sort of announce yourself ahead of time and make sure you stand in the corner and then don't touch anything, type of thing in the OR. So hopefully that'll come back someday. But in the clinic, people can still come. I'm happy to host people in clinic, and as long as we make sure the patient understands that, hey, I'm here observing. I've done that in the past with high school students or college students, or PA students or physical therapy students that want to get some experience. So I think those opportunities are out there. I'm happy to do it. And I think it's important as we go forward with technology, or as we have more people that don't have a traditional clinical experience or background, that we get them in that environment and make that accessible.
Yeah, I think that's amazing and super important. What do you like when you say to a digital health company, like, hey, you could come and shadow? Like, are they excited about it, or do they think, oh, I got this, man, I already know the solution?
Yeah, I think it depends. I think some are excited about the prospect. I think others feel like, that's why we have clinical people on our team, or we have a panel of SMEs or whatever it is that we can go to. But I think it's different. It's not the same. Yeah, and it works two ways. I think physicians too have to be willing to sit down with tech teams or what have you. Don't necessarily have to learn to code or be a master technologist, but if you understand some of the technology aspect of it, or at least you're open to learning that or adopting that, I think that's what we can do from a clinical perspective too. I think it's the coming together of those two aspects that are really going to make things successful.
Yeah. Now, in the orthopedics space, when I think of more like traditional telehealth, through the years, I've had plenty of orthopods be like, Sam, you're crazy. Can't do anything virtually, remotely.
Yeah.
Please get out of here. I must touch. I must do
Yeah.
everything. Please leave my office. I'm like, okay, I'll come back in 6 months. Obviously, COVID really flipped that on its head. And then also we see this huge rise, of course, in all the MSK digital solutions trying to avoid unnecessary surgeries. So for you, what do you see in that like more traditional virtual care and orthopedics over these next, say, 2 years?
Yeah, no, I think you hit the nail on the head. I think orthopedics, as much as any other specialty, is more hands-on. You're never going to replace all of orthopedics with virtual care, but I think there are opportunities, and I think it has to be well thought out and make sense to implement virtual care in orthopedics in ways that don't take away from the normal way of doing things, but enhance what we're doing. And I think it's really about that 360-degree care, and it's not just about avoiding surgery. We're going to see a lot of orthopedics shift to the outpatient setting. So there's an opportunity. A patient that used to be in the hospital 3 or 4 days now is going home the same day as surgery, or they used to go to a rehab facility and now they're going home. That's a way that we can implement technology to keep in contact with that patient, so you don't feel like, before I was in the hospital 3 or 4 days, I had multiple sessions with the physical therapist, I had a nurse educating me, or I went to a rehab facility and I was there for 3 weeks and I learned the ropes. Now I'm going home. Now what do I do? Well, that's an area where technology can be implemented to guide the patient at home, make them feel more comfortable and get more touch points with their care team. You can't show up at the office every day after surgery, but the office can kind of come to you. So that's an opportunity. I think obviously Hinge Health and Sword Health, these companies are now billion-dollar valuations. You have Vori Health and you have Kaya Health and you have Icon Health. There's a lot of them out there. But I think there's an opportunity to sort of capture that 360-degree view of musculoskeletal care, and a part of that's going to be virtual, a part of that's going to be value-based care, however you want to define that. Not everybody, some people need surgery, right? Not everybody can avoid surgery, and if it's appropriate and it's the right thing to do, make sure that person's getting the appropriate care. So I think to me, that's the opportunity. It's not just about avoiding surgery and saving money for employers. It's really about just taking MSK and making it better and more efficient, using technology in ways that make sense, but taking kind of a holistic 360-degree approach to it.
I love that. And about the outpatient surgery, because you're right. When it switches from I went to rehab or I was in the hospital, now I go home, because I can even think a really good friend of mine, her father's elderly, he needs a knee replacement, but because of everything else he's got going on, they determined, no, he's not a good fit right now, because it was going to be, you have to be released immediately to home. And they knew that wasn't really going to work. So when you look at that, because right now that would happen more in like the surgery, and then the clinic takes over that other part, or that would have happened in the hospital or long-term care. But that's different than the Change Health. That's different than the innovative solutions out there, right? They're more front end, not necessarily back end.
Right.
So
Exactly.
do you see that coming out of the hospital has to change their mind, or is someone going to come along that like an orthopedic practice would trust to be, okay, now you're our virtual hands for what we would have had in the hospital?
Yeah, I think it's that latter, and whether it's an existing company or a new company, or somebody that's newer on the scene is going to figure out how to close that gap. I think to me that's the 360-degree loop. You might meet that person, when they have an injury at work or what have you, and then they go through that program and they get virtual PT or whatever. Yeah, a lot of those patients are going to get better and they're going to go back to normal life, but some of them are going to continue on down that road and maybe end up needing surgery at some point. And so how do you keep that patient within your platform and really be that 360-degree? I think as surgeons, particularly in private practice, if we have a company that comes to us that we know can implement our protocols and do a great job and keep that patient out of the ER and give them a great experience, I think that opportunity exists, that surgeons would be willing to work with a company that provides that sort of service to their patients.
Yeah, I like that. That's really, I hadn't really thought about that component of it, but it's almost It's almost the same where I had another podcast about which health system is going to be the one that's courageous enough to be the back end for virtual first companies, right? Because everything can't be virtual. Someone has to have that other. So in orthopedics, you could almost look at that. Who's the back end to taking the MSK virtual first? And then the other side, who then handles the post-op to really have 360-degree care.
Yeah, and my pipe dream has always been to take it even a step further and say we're going to roll that all into one sort of entity of we're going to provide the surgeon, we're going to provide the facility, we're going to provide the front end, the back end, and it's all going to work together. Can you create that? I don't know, but I think that opportunity exists. And what better way to really get high value integrated care that if that person is getting the same process, the same organization, the same protocol from start to finish, I think that's how you really control the whole process, get great outcomes. So the person comes in, maybe they're going to need surgery, but like the example you provided, well, you're not healthy enough now, maybe we can get you healthier, and we're going to control that process. So by the time you see our surgeon, you've gone through our process. We know you're as healthy as you're going to get. We understand everything about you medically. We know, what potential problems might arise. We can try to address them ahead of time, and then we can, make sure we keep an eye on it afterwards. And then we're going to guide you through the post-operative recovery process and let our doctors and surgeons, focus on, what they're good at and what they want to do, and we'll handle this part of it. So to me, that's really the holy grail, and maybe that's 720 degrees or whatever you want to call it. The circle to the sphere, the whole three-dimensional picture of MSK Health. And maybe one of these companies will go in that direction.
Yeah, I like that, because it's almost like we see that in things like transplant, right? You come in and it's a whole process. And I think what we've seen with MSK, you and I have talked about this before, is like value-based. The bundle became so restrictive of what the bundle was. You couldn't actually do everything else because the pricing on the bundle was all about the surgery part, that DRG, not the actual full scope of care that needs to happen.
Yeah, I think that's going to change. I think the bundles, at least the ones through Medicare, unfortunately have become a race to the bottom, and you can't stay in it for more than 2 or 3 years without sort of losing out. I think the next step is going to be disease-specific bundles, and really not just around an episode of surgery, but really about, from start to finish, when that person first comes in with their knee arthritis or their back pain or what have you, and then through that whole kind of journey process. So I think that opportunity exists.
That's pretty cool. All right. My last question, which I always love to ask, especially to physicians, if you could fix one thing in healthcare, what would you fix?
Yeah, I think it's, kind of going back to the previous discussion, it's really about the doctor-patient relationship. I think that's, to me, what's at the core of healthcare, and a part of the reason we've gotten to where we are is we've gotten away from the doctor-patient relationship for a lot of different reasons. There's barriers. Unfortunately, technology has become a barrier in some situations to the doctor-patient relationship. There's so many, administrative hoops to jump through now. There's insurance hoops to jump through now on both sides, doctor and patient, and all that stuff, takes a little bit of time away, and then it adds up, and all of a sudden it's that 5-minute rushed visit where it's, in and out. It's very transactional, and patients like, what just happened here? I waited 3 weeks to get this appointment, and I got 5 minutes with the doctor, and then they gave me a prescription, and told me to do this or do that or sign up for surgery. And that's, I think, a part of it leads to dissatisfaction with the system. I think it leads to worse outcomes too, because patients aren't educated, they're not engaged, they don't have that relationship. So I think anything, in particular, as we see technology coming into healthcare, it's got to support that doctor-patient relationship and establishing that relationship, because I think that's at the core of what makes healthcare work and what we've really gotten away from.
Yeah, and I couldn't agree more. And I think sometimes people forget, and in my work, I always say, like, I serve clinicians so they can serve patients, because you all went into this as heart-centered people to take care of people. And so if it's about being a robot or only 5 minutes, you have that issue of, hey, this isn't what I came to do either. Now, of course, you're a surgeon, so you like banging on cutting things and big saws.
You can't bang and cut on everybody.
Exactly. But it's still a heart-centered place. And so I think that's super important, is we can't forget that even if I may not need a close relationship with my doctor, when something is seriously wrong, I better trust that person I'm talking to and who's doing that intervention.
Exactly. It doesn't have to be, an hour-long heart-to-heart discussion, but it's about developing that trust. And so that, when you have that discussion or shared decision making, that trust is there. And so you feel confident, you don't feel like you're on your own. And I think to sort of tie it back to the first question, as we see some of these solutions come in, I think that's something that companies should keep in mind, that you can't cut the doctor completely out of the process, and patients want that relationship maybe more than you realize. We're not faultless either, and we haven't done a great job of maintaining that relationship. So in a way, maybe we brought this on ourselves as physicians to some degree. But if you have a company that's providing, some type of service to a patient directly, they want a relationship with a provider, usually a doctor, maybe somebody else, but at least it's that consistent person that they trust, and not, I use this service today, I'm going to get somebody different than if I use it tomorrow or next week or a month from now. So I think that's something that maybe digital health companies should keep in mind.
Awesome. Yeah. Well said. Well, thank you so much for joining me today. I always love to have an opportunity to chat. And again, your time is very valuable. So I appreciate you coming on the show.
My pleasure. Thanks for having me.
And that's it for this episode of Sam Talks Telehealth. Isn't it awesome to get a chance to talk to providers, learn what they're doing, how they're doing it, and what they see as the future? Don't forget to subscribe to the podcast so you know when we're dropping everything new. And of course, you can always visit me personally on telehealtheasy.com. We'll see you back here next time.